Let's finally clear up the difference between CT scans, X-rays, and MRIs once and for all. Hi, I'm Merzad, a nursing professional, and this is the health world of medical. Has a doctor ever told you to get a CT scan, an X-ray, or an MRI, and you weren't sure what the difference was or what each one shows? If so, this video is for you. Let's start with the simplest and oldest method, the X-ray. It's the most common type of imaging. Most people have had at least one. This method uses X-rays to create a two-dimensional image of the inside of the body. It's mainly used to check for bone fractures and during dental exam. It's fast, affordable, and simple, but it shows limited detail, especially when it comes to soft tissues. Now, a CT scan or computed tomography is a more advanced version of an X-ray. It still uses X-rays, but it takes images in slices from different angles. Then a computer combines those slices into a 3D image of the body. CT scans are more accurate than X-rays and are used to detect bleeding, identify masses, and examine bones and organs in more detail. However, since CT uses more radiation than an X-ray, it should be used carefully in children and pregnant women. MRI or magnetic resonance imaging doesn't use X-rays at all. Instead, it uses magnetic field and radio waves to produce highly detailed images of soft tissues. It's especially useful for imaging the brain, spinal cord, ligaments, muscles, and tumors or masses. When a detailed view of soft tissues is needed, MRI is the best option. It doesn't involve radiation and is completely safe for the body. However, it takes longer, usually around 45 minutes, and it's performed inside a closed space, which can be stressful for some people. Also, people with metal in their bodies, like pacemakers or implants, may not be able to undergo an MRI. Also, it's more expensive and not always available everywhere. Sometimes, to get a clear image, a contrast material is given to the patient. It helps certain areas show up brighter on the scan, making it easier for doctors to distinguish between healthy and abnormal tissues. Contrast is used to examine blood vessel, tumors, the stomach, intestine, and also to assess kidney and urinary function. The contrast can be given by injection, orally, or both. In patients with kidney issues, caution is needed, and kidney function is tested beforehand. After the procedure, it's recommended to drink plenty of water to help flush the contrast out of the body. MRIs can also be done with contrast, which is generally low risk and helps produce a clearer image of the brain, spinal cord, liver, and heart. Now that you understand how this imaging method works, next time your doctor recommends a CT scan or an MRI, you'll understand why, you'll feel less anxious, and you'll be more in control. I'm Merzad, and professional nurse, and your health is my top priority. If you found this video helpful, don't forget to like and subscribe. See you in the next video.